Hi everyone, we are actually at Milan at the moment, so welcome to another video for UKMS today. So we are at ECTRIMS, which is the European Committee for Treatment and Research in Multiple Sclerosis. So this year actually the meeting is a joint one with ECTRIMS, so it's an American version. Right, I'm going to let Amy and Kat introduce themselves.
Hi, I'm Amy Harbour. I'm an MS specialist in South East Hampshire, so primarily community-based, and I also work with Kat.
Hi, my name is Kat Alexander. I'm a Band 6 nurse working in South East Hampshire in a community-based setting.
So as you are all aware, I'm Mavis. I work in Southampton. I'm the co-chair for UKMS today, and Amy here is one of our committee members, and Kat will soon be a committee member at some point. She's a member at the moment. Right, so what sessions did you guys attend that you think will change your clinical practice or will help, will have a positive impact on that?
Well, I think the main theme going throughout many of the conferences at the moment is Ayer.
Yeah.
And so I attended a healthy lifestyle one, which was really, really interesting. There wasn't necessarily things that were new and jumped out as being, that's going to change everything, but it was just reinforcing the fact that healthy diet, exercise has a massive link to MS progression. So it's good just to reinforce all those thoughts really.
Yeah.
How about you, Kat?
A standout one for me was a session on symptomatic management to improve quality of life for patients. And I think going into a clinic setting, that was really valuable. It gives you the evidence behind what treatment options we're using and why we're using them, but also rather than sort of cementing the knowledge that you already have, but gives you new knowledge on different things that you can try, and the evidence is there to say that these things work. So for me, that was a real standout.
They were saying, weren't they, ketamine is going to be used for fatigue, which that really shocked me. And I know they're using it quite widely at the moment, so that was really interesting to know, and that symptom management as well.
Yeah.
I thought out of everything that would be a drug that you wouldn't use for fatigue, but it was really interesting data.
Yeah, but it's something to I think look forward to, because fatigue affects more than 90% of our patients, and it's such a difficult symptom to manage.
Absolutely. And it has such a knock-on effect, doesn't it?
Yeah.
So everything else as well. So if you've got fatigue, everything else kind of spirals from that, doesn't it? So if we could control that better, then we would a lot of our patients would be in a better position.
Yeah, definitely.
Yeah. I think for me it's around symptom management as well. One of the speakers mentioned something that really sort of, I wrote it down yesterday, because in terms of managing, for example, spasticity, we need to really hone in on what the patient's goals are.
Yeah.
So, is it pain? Because it's not always about pain. Is it to have a good night's sleep? Is it to give my carer a break? So we really need to hone in on what the goals are, because it's not our goal, it's their goal. And sometimes we assume that the goal is to get rid of the spasms, but actually most of our patients need a bit of spasms to actually get up and mobilize. So that was quite interesting for me. And it was just, I think we do that in clinical practice anyway, but it's just trying to bring it back to patient care.
Yeah.
What did you think about the fatigue versus fatiguability, Mavis?
I know, that was quite interesting sort of concept as well, that they're really different. So what is, fatigue as a symptom, and what is fatigability because of the other symptoms, I guess. So that's kind of how I put that in my head yesterday. Are there any sessions that you would have wanted to attend that wasn't part of the program?
Yeah, I think it was very light on nurses, like any nurse talks, so that throughout the 3 days there were only 2 sessions, which I thought was quite disappointing, especially because so many nurses are now invited to conferences like this, and I'll be the first to say some of the scientific talks were so in-depth that went over my head, so I think something is, from a nurse level, a few more of those would be really beneficial.
And I think that is a shout out to all UKMS nurses actually, that we need to take more responsibility and accountability to put ourselves forward, because we are doing really great things, and we just need to advertise ourselves a bit more, I think. Have more voice, and we have another conference that we go to, CMSC, which is more practical, I guess, in terms of nursing care and other healthcare professionals. But I do agree that we need more sessions at ECTRIMS, definitely, and spread throughout the 3 days as well.
And nurse
Yeah.
speakers as well, not just
Yeah.
the nurse sessions.
Yeah.
'Cause
Yeah.
it is very doctor heavy, isn't it?
Yeah.
Which is great. It's very interesting, but nurses, the amount of work that's going on,
Yeah.
that needs to be heard.
Yeah, yeah. If I sort of, what's your main takeaway or highlight of ECTRIMS?
Smouldering MS.
Okay.
That's
Yeah.
everywhere we look,
Yeah.
isn't it?
Yeah.
That I think that's what they want our take-home message
Yeah.
to be.
Yeah.
That it's hand in hand with Europe, really, isn't it? So I think you can't get away with that. Like just walking around the conference constantly. So I think it would be that, but it would also be a lot of practical things. The posters were brilliant.
Yeah, definitely.
They were fantastic.
Yeah.
So there's lots of little elements that I've taken photos of to kind of reference back.
Yeah.
So I don't know what my actual take-home message is now, actually.
Yeah, I think the poster sessions was really insightful to see what is going on, not just in where we are, but in the whole world, really, with regards to MS. And for me, being a first time at a conference like this, I was just amazed at how many people are in the world of MS. When you're working in your teams, it's quite small, but so it was really inspiring to see so many people working for the same cause to make life better for our patients.
I think for me, a poster is always a highlight, and I always attend the poster session in the afternoon because not everyone can present their work in the plenary, but actually they have really good posters. So poster session definitely for ECTRIMS.
Definitely.
So thank you very much, Kat and Amy, and until our next video. Bye.
Bye.
Bye.